Early on in the pandemic, we showed you long lines of people wanting to get tested to see if they have been exposed to COVID. Well, now those lines are long, but they're mostly made of school-age children. New at 11, CBS 17's Galat Malamed is live for us. And Galat, why are more children getting tested now?
Rod, the pediatrician I spoke to, says that over the summer, most of the COVID tests she gave were to symptomatic children. But now, in order for students to return here to school after quarantine or being sent home with a sore throat or a cough, they sometimes need a negative COVID test. And that's keeping pediatricians busy. When students went back to school, things started to get busy at Premier Pediatrics in Lillington.
Wow, thanks to the Delta surge, now we're full steam busy just about every single day.
In Harnett County, students in quarantine can return after 7 days, only if they receive a negative COVID test at least 5 days after exposure. Without a test, the quarantine is 10 days.
We've had a lot of patients coming in just to follow the rules, and that's important.
Langdon says she anticipates doing more tests now that masks are optional in the district. Under DHHS guidelines, unvaccinated students not wearing a mask are required to quarantine after being within 6 feet of a positive case for longer than 15 minutes in a 24-hour period. She says up to now, that meant most exposures happened at lunch.
We are now about to see how much, over these next few weeks, how much that increases if children in the classroom aren't masked at all, because it's going to be so much easier to pass that 15-minute mark if they're not wearing a mask even in the classroom.
It's not all COVID keeping things busy. She says the unusual summer RSV surge is continuing, and it's peak ragweed allergy season. According to DHHS, students with COVID symptoms need a negative COVID test or an alternate diagnosis from a doctor to return to school more quickly once they feel better.
If we see them and they test positive for strep, maybe, we typically still test for COVID because we're nervous these days. And we have had occasionally patients who had both strep and COVID, so we would test them before they went back.
Langdon says about 90% of sick visits to her office include a COVID or an RSV test. And while she's busy, she says that there's always appointments available for day of emergency visits. Live in Raleigh, Galat Malamed, CBS 17 News.